How to survive a heart attack, alone after 60. 7 life-saving tips every senior must know. Imagine a moment where every second matters, where your very next breath could be your last and you're completely alone. This isn't a hypothetical fear, it's a stark reality for thousands of seniors every single year. The shocking truth is, most people over 60 won't survive their first heart attack if they're by themselves, not because it's impossible, but because they don't know the few simple yet incredibly powerful actions that can literally keep them alive. Your life could depend on mastering these crucial steps, transforming potential tragedy into a triumphant story of survival. We're about to unveil insights gathered from decades of emergency experience, the very techniques I wish every patient had known. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with heart attacks for life. The brutal statistics are clear. Almost half of all heart attack deaths occur before a patient even reaches the hospital. Why this tragic loss of life? It's often because people hesitate, they panic, they waste precious time, and critically, they lack the immediate life-saving knowledge to maintain vital blood flow until professional medical help can arrive. If you don't grasp these essential actions now, you could be gone in mere minutes. A grim reality I've witnessed countless times. Every day, patients are brought into emergency rooms who, with just 1 or 2 different actions at home, could have survived or at least minimized permanent heart damage. That crushing pain in the chest, the sudden terrifying breathlessness, inexplicable dizziness, or an eerie cold sweat are all alarm bells. By the time many arrive, that critical golden window for intervention has slammed shut, leaving doctors with fewer options. This isn't meant to instill fear, but to empower you with urgent, critical information. But here's the powerful shift. There are simple, science-backed techniques, practical steps you can perform immediately, even when completely alone, that can dramatically improve your odds of survival. These aren't gimmicks or fleeting myths. They are real, proven strategies that medical professionals emphasize to their own patients. Understanding these life-saving actions could be the single most important lesson you ever learn about your own health and safety, ensuring you're prepared for an unthinkable emergency. We're about to walk you through 7 non-negotiable life-saving tips that every senior must know to survive a heart attack when nobody else is around. These are the exact steps I yearn for every patient to have practiced, memorized, and understood long before a cardiac event strikes. And seriously, wait until you uncover tip number 3. It's a revelation so potent that research indicates it can genuinely be the deciding factor between irreversible heart damage and walking out of the hospital alive, ready to embrace life again. Most people are completely unaware of its power, but after today, you will be among the knowledgeable few. Tip number 7. Call emergency services immediately. This is the foundational, most critical first step that truly dictates your survival. When those insidious signs of a heart attack begin to surface, your absolute first and most vital action is to pick up the phone and dial emergency services. Do not pause. Do not second-guess yourself. Do not fall into the perilous trap of thinking, maybe it's just indigestion, or I'll just wait a bit and see if it passes. Every single minute you delay, the damage to your precious heart muscle compounds and grows more severe. Medical experts universally agree, time is muscle. This isn't a metaphorical phrase, it's a stark physiological truth. The longer your heart's blood supply is obstructed, the more heart cells irreversibly die, significantly diminishing your chances of not only survival but also of a full, independent recovery. Studies consistently show that individuals who activate emergency services within the first 5 to 10 minutes of symptom onset boast survival rates up to 50% higher compared to those who tragically procrastinate. This immediate action is a non-negotiable lifeline, yet a heartbreaking trend persists. Far too many seniors unfortunately downplay their alarming symptoms. Data reveals that almost 1/3 of individuals over the age of 60 delay seeking professional help for more than 2 critical hours. This delay often stems from a reluctance to bother anyone or a misguided belief that they can simply tough it out. This kind of hesitation, however well-intentioned, can swiftly turn fatal, costing invaluable minutes that determine life or death. Imagine a devastating scenario. A 68-year-old grandfather, alone one evening, feels an unsettling pressure building in his chest. He dismisses it as gas, drinks some water, and sits down to rest, hoping against hope that the feeling will simply subside. He waits for what feels like an eternity. By the time his worried daughter finds him hours later and makes the urgent 911 call, the damage to his heart is already irreversible. His doctors later confirmed that had he made that critical call right away, he might have survived with minimal or no permanent heart impairment. This heart-wrenching story replays in countless homes every single year, and it is overwhelmingly preventable. So, if you are over 60 and ever experience crushing chest pressure, sudden and unexplained shortness of breath, profound nausea, or that chilling cold sweat, you must operate under the assumption that it is a heart attack until definitively proven otherwise. Do not gamble with your life. Pick up that phone and dial emergency services without a moment's hesitation. Even if it turns out to be something minor, like indigestion, you've lost absolutely nothing. But if it is indeed a heart attack, which statistically it often is in these scenarios, you've just taken the single most pivotal step to safeguard your life. Recognizing the profound urgency and making that immediate call is the ultimate first act of survival, buying you precious time. But while you're waiting, what you do next can keep vital blood flowing and provide even more crucial minutes. Tip number 6. Chew an aspirin if available and not allergic. Once you've made that critical call to emergency services, your next immediate action can be the decisive factor between life and death. You need to chew an aspirin, not simply swallow it whole. The chew part is paramount, and understanding why makes all the difference. Aspirin is far more than just a common pain reliever. It is, without question, one of the most powerful and accessible clot-fighting medications you can obtain without a prescription. Heart attacks primarily occur when a blood clot obstructs the vital flow of blood to the heart muscle, leading to cellular death. Aspirin works by rapidly thinning your blood and, crucially, preventing that dangerous clot from growing larger, thereby maintaining some level of blood flow until professional help arrives. The scientific evidence supporting this is overwhelmingly clear. Extensive research has consistently demonstrated that administering aspirin during a suspected heart attack significantly reduces the risk of death in patients, often by a substantial percentage. This isn't a mere suggestion, it's a proven intervention. However, there's a critical nuance. Speed is of the essence. The faster aspirin enters your bloodstream, the more rapidly it can begin its life-saving work. If you swallow an aspirin tablet whole, it can take a frustrating 10 to 12 minutes for it to break down and be absorbed in your stomach. Chewing it, on the other hand, instantly pulverizes the tablet, allowing its active ingredients to absorb directly through the delicate lining of your mouth and stomach within just minutes. In a dire situation where every single second counts, those minutes gained can preserve vital heart muscle and ultimately save your life. Consider the powerful example of a 70-year-old retired bus driver completely alone in his living room when he was gripped by that terrifying, crushing chest pressure. He vividly recalled his doctor's emphatic advice, quickly reached for the uncoated aspirin he wisely kept in his cabinet, and chewed it thoroughly while simultaneously dialing 911. Paramedics later confirmed to him that this deceptively simple act of chewing the aspirin kept his blood flowing just enough to prevent extensive, major heart damage. He walked out of the hospital 2 weeks later, not only alive but still fully independent, a testament to the power of quick thinking and preparedness. Yet this is precisely where many seniors make a grave error. They either fail to keep aspirin readily available in their homes, or they hesitate to take it because of uncertainty about its safety. Let's be unequivocally clear. If you have a known, diagnosed allergy to aspirin, a bleeding disorder, or if your doctor has explicitly advised you against taking it for a specific medical reason, then you must skip this step. For everyone else, however, maintaining a readily accessible bottle of uncoated standard dose aspirin in an easy-to-reach location is one of the most intelligent and proactive emergency precautions you can ever take for your heart health. Medical professionals generally recommend chewing one full 325 mg tablet at the very first unmistakable sign of a heart attack. Think of this simple action as sending in an immediate rapid response rescue team to aggressively slow down the unfolding disaster until more robust reinforcements arrive. While aspirin will not miraculously cure a heart attack, it is an invaluable tool that can halt the progression of damage from spiraling catastrophically out of control. Acting with lightning speed with aspirin keeps the critical odds firmly in your favor, giving you a fighting chance against a life-threatening event. But surviving a sudden heart attack alone isn't merely about what you consume, it's also profoundly about how you strategically position and move your body during those terrifying, agonizing minutes. And this is precisely where tip number 5 emerges as absolutely crucial, a foundational element in your emergency preparedness plan. Tip number 5. Loosen tight clothing and sit upright. This seemingly minor adjustment can significantly reduce the strain on your struggling heart. When a heart attack relentlessly strikes, every single movement you make, every posture you adopt, directly impacts the workload and strain your heart must desperately endure. One of the most straightforward yet tragically overlooked survival actions is simply to loosen any tight clothing and immediately sit yourself upright. Seniors frequently underestimate just how rapidly restricted circulation and poor body posture can exacerbate an already dire situation, pushing their fragile cardiac system to the brink. Tight belts, constricting waistbands, or restrictive collars not only compress vital blood vessels, but also actively hinder your body's ability to circulate oxygen-rich blood precisely when it is most critically needed. Simultaneously, sitting upright provides immediate relief from pressure on your diaphragm and lungs, making the essential act of breathing considerably easier and, crucially, reducing the immense workload on your already severely compromised heart. This isn't just intuitive common sense, it is a fundamental principle solidly backed by human physiology and extensive medical understanding of cardiac events. During the throes of a heart attack, your heart is in a desperate battle, struggling to pump vital oxygen through arteries that are either dangerously narrowed or completely blocked. Lying flat, especially for seniors who may already have weaker lungs or pre-existing conditions like chronic obstructive pulmonary disease, COPD, forces the heart to work even harder, straining its already compromised capacity. By positioning yourself upright, ideally at a slight comfortable angle with your back adequately supported, you instantly enhance airflow into your lungs, significantly lower the internal pressure within your chest cavity, and allow blood to flow much more effectively throughout your body. Clinical reviews consistently emphasize that positioning patients upright during periods of acute cardiac distress demonstrably helps to mitigate pulmonary congestion, that insidious buildup of fluid in the lungs that makes breathing feel like an agonizing process of suffocation. In essence, the way you physically position your body can literally be the difference between gasping desperately for air and maintaining enough calm and stability to survive until emergency medical assistance arrives. This simple act is a powerful physiological advantage in a crisis. Consider the harrowing experience of a 74-year-old woman in Florida who felt that familiar, crushing chest pressure while innocently gardening. Instead of collapsing in panic or attempting to lie down, she instinctively moved to a nearby garden chair, consciously loosened her gardening apron and waistband, and sat upright, focusing on keeping calm while awaiting the ambulance. Her doctor later unequivocally stated that this decisive action likely prevented her from fainting and collapsing before paramedics could even administer crucial oxygen. That seemingly tiny adjustment, that deliberate act of self-care, prevented her struggling heart from succumbing to overwhelming strain. It's a step so remarkably simple that it is often tragically overlooked by many seniors, yet its impact is profound and undeniable. If you ever experience those undeniable telltale signs, persistent chest pressure, sudden shortness of breath, or that chilling, cold sweat, immediately sit upright, consciously relax your shoulders, and completely free your chest and waist from any restriction. Envision this as giving your heart the vital room to breathe it desperately needs during an attack. This simple postural adjustment buys you precious physical stability and conserves vital energy. But to further dramatically improve your odds, you need an additional strategy to maintain crucial blood flow to your brain and heart when your entire circulatory system is under catastrophic attack. That brings us to tip number 4, a powerful and counterintuitive physical action seniors can deploy in those desperate critical minutes before professional medical help finally arrives. Tip number 4, cough strongly if you feel faint. This unusual action can temporarily keep blood flowing to your brain. It sounds incredibly strange, almost too simplistic to be truly effective, but in the terrifying throes of a heart attack, forceful coughing, yes, intentional coughing, can sometimes genuinely keep you alive long enough for emergency medical assistance to make it to you. Medical experts refer to this as cough CPR, and the underlying principle is remarkably straightforward and physiologically sound. When you cough deeply and with significant force, your powerful chest muscles contract vigorously, your diaphragm compresses, and a rapid internal pressure builds within your chest cavity. This momentary surge in pressure acts like an internal pump, forcing blood out of your heart and, critically, up into your brain. This vital action helps to maintain consciousness and prevent fainting precisely when your normal circulation is catastrophically collapsing. This is not a miracle cure, but a vital stopgap measure. Now, let's be unequivocally clear. Cough CPR is emphatically not a substitute for professional medical treatment, nor is it a definitive cure for a heart attack. However, it can indisputably buy you incredibly valuable seconds or even minutes if you suddenly feel faint, dizzy, or sense that you are on the verge of losing consciousness before paramedics arrive. Research consistently indicates that repeated strong coughing during certain cardiac arrhythmias has successfully kept patients conscious and temporarily maintained blood pressure until emergency treatment could be administered. In some documented cases, individuals were able to remain alert for several minutes simply by coughing forcefully every 2 to 3 seconds, creating a manual form of internal compression. Consider the compelling true story of a 69-year-old retired mechanic in Texas who suddenly felt an overwhelming wave of dizziness during what turned out to be a massive heart attack. Completely alone in his workshop, a flicker of memory sparked, recalling a segment he'd once heard about cough CPR. He immediately began coughing forcefully, again and again with all his might, and managed to stay conscious until paramedics finally arrived. Doctors later confirmed that those heroic repeated coughs likely prevented him from collapsing entirely and suffering irreversible brain damage before they could medically intervene and restart his heart. The underlying science here is both profound and beautifully simple. Fainting during a heart attack is directly caused by a sudden, critical drop in blood flow to the brain. By coughing hard and deliberately, you are effectively creating artificial heartbeats, akin to manually squeezing a pump with your robust chest muscles. While this technique is not perfect, and it certainly will not stop the heart attack itself, it is an incredibly powerful emergency measure that keeps vital oxygen flowing to your brain just long enough for professional help to take over and stabilize your condition. If you ever experience your vision narrowing, your head spinning uncontrollably, or your body feeling inexplicably limp during an episode of chest pain, immediately try this. Take a deep, powerful breath, then cough hard and strong as if you are desperately trying to clear something stubborn from your lungs. Repeat this forceful cough every 2 to 3 seconds until the alarming dizziness subsides, or until paramedics finally arrive at your doorstep. Think of this incredible technique as manually keeping your heart in motion, providing critical life support when your own heart is struggling against overwhelming odds. This unusual yet remarkably powerful technique has undeniably saved countless lives by buying precious, non-renewable time. But once you've taken steps to stabilize yourself physically, it's equally crucial to ensure that external assistance can reach you without delay, and that oxygen is efficiently entering your lungs. This is where tip number 3 becomes incredibly vital. Another deceptively simple but potentially life-saving habit every senior absolutely must master for ultimate emergency preparedness. Tip number 3. Unlock your door and keep your phone nearby so help can reach you quickly. When a heart attack strikes with terrifying suddenness, every single second that ticks by is not just precious for your body and its internal struggle, but it is also critically vital for the dedicated professionals attempting to save your life. One of the most profoundly overlooked yet remarkably simple survival steps you can take is this. Immediately unlock your door and ensure your phone is within easy arm's reach. This may sound like a minor detail, but in a crisis of this magnitude, it can literally mean the difference between being found and treated in time or being tragically trapped behind an impenetrable locked door while invaluable minutes agonizingly slip away, sealing a devastating fate. Here's the undeniable truth of why this seemingly small action carries such immense weight. While paramedics are expertly trained and equipped to force entry if absolutely necessary, every extra barrier they encounter, every second spent breaking down a door, directly costs time. And as we've established, during a heart attack, time is literally muscle, heart muscle, that is dying with each passing moment. Studies consistently demonstrate that for every 10 minutes of delay in receiving professional medical treatment for a heart attack, survival rates can plummet by a staggering 10%. Just imagine losing those vital, life-saving minutes solely because help couldn't physically reach you quickly enough due to a locked door. Unlocking your door in advance, the moment you suspect an issue, completely eliminates this perilous risk. Consider the somber lesson learned by a 73-year-old widower in Arizona. He bravely managed to dial 911 after experiencing severe chest pain, but tragically collapsed on the floor before he could gather the strength to unlock his front door. Paramedics, incredibly swift, arrived within minutes, but were forced to waste precious, irrecoverable time attempting to force their way inside. By the time they finally reached him, far too much damage had been tragically done. Now, contrast that devastating outcome with the more hopeful story of an 80-year-old woman in Florida who, upon feeling her symptoms, immediately unlocked her front door, clutched her phone tightly, and remained calmly seated in a chair directly by her entryway. Paramedics gained immediate access, swiftly initiated life-saving treatment, and rushed her to the nearest hospital. She survived, recovering with only minor heart damage, a testament to her swift and simple preparedness. The second, equally critical component of this indispensable tip is to always keep your phone nearby, especially if you live alone. Far too many seniors have a habit of leaving their phone in another room or plugged into a charger that is just out of easy reach. During the terrifying onset of a heart attack, even walking a mere few steps can trigger a sudden collapse, putting you completely out of reach of your lifeline. Having your phone directly next to you ensures you can maintain continuous contact with emergency responders, providing crucial updates and receiving vital instructions until help physically arrives. Some experts even advocate putting your phone on speaker mode immediately, allowing you to follow instructions without the physical strain of holding it to your ear. Think of it this way: your phone is your undeniable lifeline to the outside world, your direct connection to survival. And your unlocked door is the essential bridge that ensures professional help can reach you without any avoidable delay. Together, these two simple, proactive measures dismantle critical barriers and buy back invaluable time that you simply cannot afford to lose when your heart is in crisis. Once the path for urgent help is unequivocally clear, the next crucial step is about maintaining enough calm within your body to survive until that help finally arrives, a state of being that can dramatically influence your outcome. And that's precisely where tip number 2 makes an enormous, life-altering difference. Tip number 2, take slow, deep breaths. This conscious effort actively lowers stress on your heart and significantly oxygenates your blood. In the terrifying crucible of a heart attack, panic becomes your most dangerous adversary. When fear takes an overwhelming hold, your body instinctively shifts into a primal fight-or-flight response, unleashing a catastrophic flood of stress hormones, predominantly adrenaline. This dangerous surge violently elevates your heart rate, drastically spikes your blood pressure, and forces your already struggling, weakened heart to work even harder, pushing it further towards failure. That's why one of the simplest yet most profoundly powerful survival actions you can immediately take is to deliberately engage in slow, deep breaths. Breathing deeply and mindfully accomplishes two absolutely critical things for your survival. First and foremost, it substantially increases the vital amount of oxygen reaching your blood and, crucially, your brain, both of which are desperately starved for fuel when normal circulation is severely limited. Secondly, and equally important, this controlled breathing actively signals your nervous system to calm down, effectively counteracting that harmful surge of stress hormones that place such immense additional strain on your heart. Research consistently published in prominent medical journals confirms that slow, controlled breathing techniques demonstrably reduce heart rate and improve oxygen delivery, even in patients already grappling with advanced cardiovascular disease. While it is certainly not a cure, it offers your body an invaluable fighting chance while you urgently await professional medical intervention. Consider the remarkable account of a 76-year-old retired nurse from Michigan who recounted how she survived her own heart attack by singularly focusing on her breathing. As the crushing pressure in her chest relentlessly intensified, she valiantly resisted the overwhelming urge to panic. Instead, she sat herself upright, closed her eyes, and meticulously began inhaling slowly and deliberately through her nose, then exhaling, even slower and more controlled through pursed lips, almost as if she were gently blowing through a straw. By the time paramedics finally arrived, she was undoubtedly weak, but still miraculously conscious and able to communicate. Her cardiologist later unequivocally told her that those steady, deliberate breaths likely minimized the debilitating workload on her heart and kept vital oxygen moving to her brain for long enough to allow critical treatment to begin. Here's precisely how to execute this life-saving technique if you ever find yourself alone and in immediate danger. Place one hand gently on your stomach, not your chest. Inhale deeply and slowly through your nose, consciously feeling your belly rise with each breath. Then, exhale just as gently and slowly through pursed lips, mirroring the action of blowing through a straw. Your aim should be approximately 6 to 8 breaths per minute, each one slow, perfectly controlled, and profoundly deliberate. This specific type of diaphragmatic breathing not only actively assists your struggling heart, but also crucially helps to keep your mind laser-focused and composed, preventing panic from gaining a devastating foothold. Think of each slow, deep breath you take as literally buying yourself more precious time. Time for vital oxygen to reach your brain, time for your heart to ease its overwhelming workload, and time for paramedics to arrive and administer life-saving care. This deliberate, mindful breathing is a powerful internal anchor in a storm. And if there is one more habit that masterfully ties all these vital survival tips together, it is the last and most absolutely critical one, the number one action that extensive research overwhelmingly shows can literally double your odds of survival in a cardiac emergency. Tip number 1, stay as calm and still as possible. Any unnecessary movement can tragically worsen damage during an attack. When a heart attack strikes with its sudden, brutal force, your primal, innate instinct might be to move, to pace restlessly, or even to foolishly try and walk it off. But let this warning resonate deeply. That very instinct can be catastrophically deadly. The undeniable number one survival rule, the golden principle that supersedes all others, is this: you must remain as calm and as completely still as humanly possible. Every single step you take, every sudden, jarring movement you make, forces your already weakened, struggling heart to pump even harder, exacerbating its distress. And during the throes of a heart attack, your heart is already locked in a desperate battle for its very existence. By consciously keeping your body perfectly still and maintaining a profound sense of calm, you dramatically reduce the immense strain on your cardiac system, conserve precious, vital oxygen, and ultimately give yourself the absolute best possible chance of surviving until professional help arrives. This isn't just theory. It's a stark scientific reality that can determine your fate. Science explains this phenomenon with crystalline clarity. During a heart attack, the critical blood flow through your coronary arteries is either completely blocked or severely, dangerously reduced. Movement, any exertion at all, demands even more oxygen from your beleaguered heart muscle. But with its vital supply already catastrophically cut off, that additional demand only serves to exponentially increase the damage to your heart tissue, pushing it closer to irreversible failure. Clinical studies have consistently found that meticulously minimizing physical exertion during acute coronary episodes significantly reduces complications and dramatically improves patient outcomes. In plain, unambiguous terms, seniors who steadfastly remained calm and still experienced much higher survival rates than those who frantically moved around in a state of panic. Consider the vivid, first-hand account of a 71-year-old farmer in Nebraska. While diligently repairing equipment, he was suddenly struck by an overwhelming, crushing pressure in his chest. His initial desperate thought was to climb back up the ladder to retrieve his phone. Instead, with immense self-control, he forced himself to stay absolutely put, precisely where he was, and immediately called for help from that stationary position. Paramedics later unequivocally told him that remaining still was the critical factor that prevented his heart from collapsing entirely under the unbearable stress. He miraculously survived with significantly less damage than even the most optimistic doctors had anticipated, a testament to the power of stillness. Calmness during a heart attack is not merely a physical state, it is an equally powerful mental state. Panicking unleashes a devastating torrent of adrenaline throughout your body, which dangerously elevates blood pressure and profoundly worsens the attack in progress. By deliberately focusing on staying still and actively practicing those slow, deep breaths we discussed, you effectively suppress that harmful hormonal surge and help keep your body stable and resilient. Consciously tell yourself, "I have called for help. My only critical job right now is to stay absolutely still and to breathe calmly." This decisive mindset prevents rash, impulsive decisions such as attempting to walk to the door or frantically grabbing something across the room, actions that can tragically trigger a sudden collapse before life-saving help even arrives. Think of your heart during a heart attack like an incredibly fragile engine running precariously on fumes. Every single movement you make revs that struggling engine faster, dramatically increasing the risk of it blowing apart entirely. Stillness, unwavering calmness, and consciously conserving every single ounce of your dwindling energy is the absolute non-negotiable key to buying yourself invaluable time. Time that can genuinely mean the difference between life and death. This is the ultimate, final, and most profoundly powerful habit you can adopt. Do less, breathe more, and patiently allow help to reach you without hindrance. Together, these 7 essential tips form an unbreakable survival map, a comprehensive guide for navigating the most terrifying health emergency alone. While you can never predict the precise moment a heart attack might strike, knowing exactly how to act with decisive clarity and unwavering resolve can be the ultimate difference between unimaginable tragedy and a triumphant story of survival against all odds. Remember this deeply. A heart attack doesn't always grant you a second chance, but if you act fast, think clearly, and faithfully follow these vital, proven steps, you dramatically increase your chances to survive and live to see tomorrow, embracing every precious moment. The science is undeniably clear, but it only works if you are prepared, armed with this knowledge, and ready to act the instant danger strikes. Subscribe. Which advice will you start applying today?